Does my pet really need all these vaccines? Can vaccines actually make my pet sick? Why do some vaccines need boosters every year? These are some of the most common questions we hear as veterinarians. And honestly, they're fair questions. Maybe your dog never leaves the backyard. Maybe your cat is an indoor-only cat. Maybe your pet received vaccines last year and they seem perfectly healthy. So why do veterinarians keep recommending them? The interesting thing is that most pet owners never see diseases like parvovirus or rabies. And that's actually part of the reason that vaccines have been so successful. When prevention works, it's easy to forget what we're preventing. Today, we're going to answer those questions. We'll talk about what vaccines do, what they don't do, and why they're one of the most important tools we have at protecting your dogs and cats. Because vaccines are something that almost every pet owner hears about, but not something that's always fully explained. My name is Dr. Matt Clark with Class NV Veterinary Clinic, and I'm here to help. This is Beyond the Vet Visit. Whether you're bringing home a new puppy or kitten, scheduling a routine wellness exam, or simply trying to keep your pet healthy throughout their life, chances are you've had a conversation with your veterinarian about vaccines. Even though these conversations are common, vaccines can still feel confusing. What exactly are they doing? How do they work? Why do vaccine recommendations sometimes differ from one pet to another? So today, I want to slow things down a little bit. My goal isn't to tell you what vaccines your pet should or shouldn't receive. That's a decision best made between you and your veterinarian based on your pet's individual health, lifestyles, risk factors, and local regulations. Before we go any further, I do want to set a few expectations. This channel is meant to be educational. I'm not here to diagnose or treat your individual pet over the internet, and this content should never replace an examination or relationship with your veterinarian. Every pet is different, every case is different, and your veterinarian is the person who can apply this information to your specific situation. I'm also not here to question or contradict your veterinarian. In fact, my hope is that this series helps you better understand the conversations you're already having with your vet, helps you feel more comfortable asking questions, and helps veterinary medicine feel a little less intimidating. Just as importantly, I'm not here to sell you products or push unnecessary recommendations. My goal is education first. I want to provide clear, practical, trustworthy information that can help pet owners better understand common veterinary topics. Now, with that said, if your pet is showing any signs of severe illness, please call your veterinarian immediately. To start, we need to understand what vaccines are actually designed to do. Vaccines help the immune system prepare for a future threat before a pet ever encounters the disease. Think of it like studying for a test. If you've never seen the material before, the test is harder. But if you review ahead of time, you're more likely to respond correctly. Vaccines work the same way. They allow your body to study different diseases so that if it's tested with them, they know what to do. Another way to think about it is like a fire drill. The goal of a fire drill isn't to create an emergency, it's to prepare for one. Vaccines train the immune system similarly by having a small run through the illness so that you hopefully can avoid the full disease later on. It doesn't give your pet the vaccinated illness, like you would not actually set fire during a fire drill. What it does is create an immune response in the body so that it can recognize either dead, modified, or similar viruses, bacteria, and other diseases to what they might get challenged with in the real world. Now, it's also important to understand what vaccines are not designed to do. Vaccines are preventative medicine. They're designed to help prepare the immune system before exposure occurs. In most situations, they're not treatments for pets that are already infected with a disease. For example, if a dog already has developed parvovirus, giving a parvo vaccine is not going to treat the infection. In fact, it might take away from the body's needed response to the real disease. The goal of vaccination is to help the immune system recognize and respond to a disease before a pet encounters it, not after the disease has taken hold. This is why preventative medicine and vaccines are so important for your pet individually. But there's also something called herd immunity, and this is just as important but is never really discussed. Even though vaccines directly protect your pet, they also protect other pets in the community. If most pets around you are vaccinated against a disease, it's harder for that disease to spread, even to pets that haven't been vaccinated. Think about the near eradication of diseases like polio because of vaccination. They're not about making the immune system invincible. They're about helping it be prepared. And that preparation protects both your pet and the larger pet community. By understanding this, you can see why vaccines are such a critical part of preventative veterinary medicine. Many pet owners will never see diseases like parvo, feline panleukopenia, or rabies firsthand, and that's a good thing. Vaccines haven't made these diseases disappear completely, but they've dramatically reduced the number of pets affected. The more pets that are vaccinated, the less likely the disease is to be in the environment, and the less likely pets are to be sick. That's one of the biggest successes of preventative medicine. Once a pet becomes seriously ill, treatment's often more difficult, more stressful, and more expensive. Vaccines help shift the focus from treatment to prevention, and prevention is often easier and much less risky. Let's look at a few examples of some of the diseases we vaccinate for. Rabies is a fatal virus that affects the nervous system. What makes rabies unique is that it can affect both animals and people. That's why rabies vaccination is legally required in many areas. Parvovirus is a highly contagious disease in dogs that's passed through contaminated feces. Even if you don't see any stool, your dog can pick up the virus from contaminated environments like a new yard, dog park, or even just while out for a walk. It causes severe vomiting, diarrhea, and dehydration, and affected dogs can quickly become critically ill. For cats, one example is feline leukemia virus, or FELV. Feline leukemia weakens the immune system and increases the risk of infections, anemia, and most notably, causes cancer. Feline leukemia is passed through any bodily fluid. Something as simple as your cat drinking or eating out of an infected bowl can make them sick. One thing people do a lot but don't always think about is feeding, watering, or interacting with neighborhood cats. If you do this, just petting a cat or bringing a bowl in could cause you to contaminate, or placing a bowl on your counter or in the sink could cause contamination that your cat could become exposed to. These diseases are all different, but they all share one important point. Prevention is far better than treatment. One of the most common questions veterinarians hear is, my pet stays indoors. Do they really need vaccines? Indoor pets may have a lower risk, but exposure can still occur through open doors, escapes, or nearby animals. That's why vaccine recommendations are based on a pet's overall lifestyle, environment, and risk factors. Another question is, can vaccines cause the disease they're designed to prevent? For most vaccines, the answer is no. Vaccines safely stimulate the immune system without causing the disease itself, as we discussed earlier. A frequent question is, if my pet was vaccinated before, why do they need boosters? Immune protection can change over time. Boosters help remind the immune system how to respond and maintain protection. Each vaccine can have different lengths of protection that can require boosters at different intervals, such as 6 months, 1, 2, or maybe even 3 years. It's also important to understand that no vaccine is 100% effective. Getting boosters gives a better chance at making sure your pet gets the immunity and keeps it. Vaccination reduces risk, but it doesn't eliminate risk entirely. The goal is to improve immune response and reduce the likelihood of severe illness. Sometimes this can come with short-lived side effects or in rare cases allergic reactions. Most pets experience little to no reaction after vaccination. However, mild side effects aren't uncommon and can include soreness at the injection site, temporary fatigue, or a low-grade fever. These reactions typically resolve within 24 to 48 hours and are considered completely normal. There is no difference compared to what they do than what we do when we get vaccines. Rarely, though, pets can experience an allergic reaction. Signs can include swelling of the face or limbs, vomiting, diarrhea, or difficulty breathing. These reactions are uncommon, but they do require immediate veterinary attention. Hopefully, understanding what is normal and what is not helps you feel more reassured and prepared the next time your pet receives a vaccine. One final point that I'd like to make is that vaccine recommendations are not one size fits all. Vaccine decisions depend on a pet's age, health status, lifestyle, geographic location, and risk of exposure. Young puppies and kittens, senior pets, or pets with medical conditions may be more vulnerable to disease and require special consideration. Certain vaccines may also be more important in one region compared to another. For example, Lyme disease vaccines or rattlesnake vaccines may be discussed in certain parts of the country. In Oklahoma, where I practice, we generally do not see Lyme disease or recommend the vaccine. However, in more rural areas of Oklahoma, some veterinarians may recommend rattlesnake vaccines due to the higher risk. Some vaccines, such as rabies, may be required by law. Lifestyle matters too. A pet that frequently visits dog parks, boarding facilities, daycare, or grooming salons may have a different risk than a pet that spends most of its time at home. They may be more likely to need not only the Bordetella vaccine, but maybe even the canine influenza vaccine. Cats that are outdoor have much higher risks of disease than indoor cats and may need to be vaccinated against diseases like panleukopenia and feline leukemia. But don't forget, if you interact with or have other cats around, you may still need these vaccines even if your cat stays indoors. The key takeaway is simple. Vaccine recommendations should always be individualized in partnership with your veterinarian. So, let's bring everything together. Today we've talked about how vaccines work, why they matter, examples of diseases they help prevent, what side effects are normal, and why recommendations are individualized. Every pet's different, and your veterinarian can help determine the right preventative care for your pet. If you found this episode helpful, I'd love for you to subscribe, follow along, and be part of this community. In our next episode, we'll explore those nasty bugs, fleas, and help make them easier to understand. And if there's a topic you'd like to hear discussed in a future episode, leave it in the comments. There's a good chance another pet owner has the exact same question. Thank you so much for spending some time with me today. I'm Dr. Matt Clark, and this has been Beyond the Vet Visit.